So, I want to talk about another thing I hear pretty often from my patients and other stroke survivors, and that's the fear of having another stroke. And for whatever reason, like so many other things stroke related, it doesn't actually get talked about as often as it should. Maybe every headache you get makes you nervous. Maybe every time your arm or leg feels a little funny, you wonder, is it happening again? Or maybe you have this unspoken fear of any kind of really intense exercise because you're wondering if it might trigger another stroke. If any of this sounds familiar to you, you are definitely not the only stroke survivor out there who feels this way. The truth is, after you live through something as life changing as a stroke, it just makes sense that you become more alert to anything that feels even remotely similar to what you experienced leading up to or at the time of your stroke, right? In some ways, this may be your way or your brain's way to try and protect you. It can be constant or even just frequent thoughts of, could this happen again? Or how do I make sure this never happens again? All of these thoughts are not only understandable, given your past experiences, but also completely natural. The problem only comes in if these kinds of thoughts and fears become so persistent and paralyzing that they start to impact how you live and engage in your day to day life. I have seen it where people become so afraid to leave the house, afraid to travel, afraid to exercise, afraid to let their heart rate go up, afraid every strange sensation means another stroke is starting. This can create a tremendous amount of anxiety and stress in your life. So, what can you do? First, know your personal risk factors. There are so many different reasons why someone may have a stroke. Some obvious and some reasons may still be a mystery. The key here is to talk with your doctor and get the information you need to understand as much as you can about what caused your stroke in the first place, if even possible. Was it related to like high blood pressure, atrial fibrillation or AFib, diabetes, carotid or coronary artery disease, or was it something else, something more rare? And for some, there actually may not be an immediate known cause that your doctor can find, which can be honestly the most anxiety provoking of all. Because if you don't have those traditional risk factors and yet still had a stroke, it can be very difficult to make peace with that and not let that fear of a future stroke become this like ever present cloud hanging over you. But understanding as much as you can about your own situation and getting exceptionally good at listening to your body can be the most important things you can do to try to counteract the fear that's like pressing down on you. So learn as much as you can about your stroke, what type, where in the brain it occurred, what things are associated with the type of stroke you had. And then get very clear on both the common and not so common signs of a stroke. And if you're not 100% clear on what those signs are, please check out the video I did a while back about the hidden signs of stroke you shouldn't ignore. Because just like I say in that video, knowledge is only powerful if you use it. Okay. Next, control the things that you can actually control. Take your medications, keep your medical appointments, stay active, work on your recovery, manage your blood pressure, eat as healthy as you can reasonably, and get enough sleep. All of these things can go a long way in reducing your future risk. It is important to know that once you have had a stroke, no matter how big or small, you are at an increased likelihood of having another stroke. This does not mean that you will have another stroke. It just means that you are at an increased risk of having a subsequent stroke in comparison to someone who has never had a stroke. Okay? So fortify yourself as much as possible with the information you need related to your specific risk factors, your health conditions, any medical needs, and then take action on those things in your life that you can control. And then just go live your life. Try not to let fear steal your recovery. Don't become so afraid of another stroke that you stop living. Find a way to go to the places you want to go to, talk with your doctors and therapists, and get started on an exercise and recovery routine. Keep taking steps forward. Your fears, honestly, may never completely go away, but be brave and live the life you want to the best of your ability anyway. It's just like that saying, being brave doesn't mean you're not scared. Being brave means being scared of something and doing it anyway, or it's something like that. But again, movement, consistency, activity, and rebuilding your confidence are such critical parts of recovery after stroke. So just keep taking steps in the direction that you want to go, okay? Never ignore new symptoms or if your gut is telling you something isn't right, because your gut is rarely wrong. We just have to listen to it. So if you ever experience sudden warning signs of another stroke, seek emergency medical attention immediately. Your task and goal is to replace uncertainty with knowledge, replace feelings of helplessness with action, and replace fear with confidence in the things you're doing every day to protect your health. Okay? If you feel comfortable sharing, please leave a comment and let me know if you've ever struggled with the fear of another stroke or if this is something you feel like you're experiencing now. I think a lot more people experience this more than we realize. Okay. As always, I really hope this was helpful and I will see you next time. If you found this video helpful, don't forget to subscribe for more DIY videos to help you along the way in your stroke recovery. Struggling at home? Have a question? Leave me a comment. I'm here to help.